Hello and welcome to the France 24 interview. I'm Iris Makler in Tel Aviv, where my guest is Dr. Sharon Alroy-Preis, Israel's top public health official and the woman behind its world-beating COVID vaccination campaign. In Israel, more than 5 million people out of a population of 9 million have had their shots. That translates into more than 80% of the people who are eligible. And unlike in countries in Europe and other parts of the world, there's plenty of vaccines here, all from Pfizer BioNTech. That enabled Israel to open up cafes, hotels, restaurants, gyms. Everything was open just before the recent elections. Dr. Alroy-Preis, thanks for joining me. I have to ask my first question. How did you do it? How did you persuade Pfizer to take a chance on you?
I think what was the main cause for their willingness to be part of this is the amazing public health system that we have in Israel. The fact that everyone is covered. We know everyone who got vaccine. We know every test result for Covid-19. Everything is digitalized, and so it's a really good place to see if we can pull this thing of getting to herd immunity.
Was it paying over the odds?
I have to say that I was not part of the negotiation team on that part, so I don't really know the answer for that.
Are you relieved that it's Pfizer and not another one, say AstraZeneca?
Well, I have to say it's very hard to say because trying to make connections between adverse events that happen around a vaccine and saying this is the vaccine fault is something that is kind of tricky. We know that we are following very closely in Israel all the adverse event around the vaccination. So we really feel confident that there is nothing here that should worry us.
Here meaning Pfizer?
Yes, here meaning the vaccines that we have been given.
It's just over 3 months now since Prime Minister Benjamin Netanyahu had his first shot live on TV. What have you learnt?
So first of all, we know it's doable. It's doable. You can get to a point in this pandemic, and I think Israel is the first to show it. You can get to a point in this pandemic where you open sectors and the disease goes down. This is something that has not been shown anywhere in the world so far. So we know it's doable. What we know more specifically from research that we did and others is that the vaccine is very, very efficient. We see that vaccine effectiveness is between 97 to 98% in reducing morbidity, in reducing mortality. It's 96%. It's very, very efficient. And we also know it's very safe. We gave it to 5.2 million people in Israel, and we see really minimal side effects around the time of the vaccination.
What about, that's after 2 doses, what about after 1 dose? I think I read that after 1 dose it was less effective than Pfizer had promised.
So we're still looking at the data of this. What we decided as a nation is that we would give the doses exactly as given by Pfizer and approved by the FDA, which means dose and then 21 days later a second dose. There was some kind of a debate in Israel whether to give just 1 dose to everyone like they did in Britain. We decided we're going with a protocol. So we're looking now to see if there is a benefit from the first dose. We are seeing efficiency in that too, but the main effectiveness is after a week from the second dose.
Will this be good against the variants? We know it's good against the UK variant because that's becoming the dominant strain here, but what about the other ones?
We don't know yet. So we are now looking at the data on the South African variant, which we have to some extent in Israel. It's about 1% of the samples that we have. And we will be able to see if there is the same effectiveness for people with South African variant. Other variant we don't have here, thankfully, in big amounts. So we will be able to see the effectiveness of the variants because we have a really high proportion of the population vaccinated. The South African trials are being conducted right now.
How much UK variant is there actually here?
95% of the sample. It's widespread. That's the dominant strain now.
It is the dominant strain. Wow.
Yeah.
Okay, so you can say that.
So we can say for sure that the vaccine, Pfizer vaccine, is working against the UK variant.
Israel's Prime Minister Benjamin Netanyahu famously said he couldn't win this election if the pandemic wasn't under control. Was Israel's opening up in the 3 to 4 weeks prior to the election linked to that?
No, not at all. The rollout of the exit from the lockdown was something the Ministry of Health brought to the government, and it was based on science. What we said basically is after the second lockdown, we came up with a 6-stage exit plan, which took a long time. And the reason was we didn't have any tool to reduce the risk. With this exit, we had the Green Pass. We had the ability to open places for people who were vaccinated or recovered. And so creating those zones with less infection enable us to open more quickly places. And so it was nothing to do with the election. It really was a plan that the Ministry of Health brought to the table. We were asked several times to sort of hasten things up, and we said no, there needs to pass 2 weeks between steps, as we've said all along. So really insisted on that. But the short plan was due to the fact that we can open things with a Green Pass.
So has the Green Passport, which is part carrot and part stick, has it been effective?
I think it has been very effective. I think the older population, when we opened the vaccination campaign and it was prioritized to people over the age of 60, that population went to be vaccinated because they felt the value of the vaccine itself. When we got to younger age groups, I think that the Green Pass made the impact. Knowing that you need to go with a Green Pass to restaurants and to social events and to other places, I think made the difference.
How will you get that final group of people who haven't been vaccinated, so it's less than 1 million now, but it is still a few 100,000, how will you get them into the clinics?
I think people probably are to some extent afraid. I think that there is a small proportion of people who really are against vaccinations, and they are entitled to, and that's their right. I think probably most of the 1 million that needs to be still vaccinated are people who want to see what is happening and to see the adverse event. And once they see that it's really safe, and the people who are now sick in the hospitals are those who are not vaccinated. 90% of the people in hospitals now are either not vaccinated at all or did not complete yet all the protocols. So we really see the effect of the vaccines. And I hope this will encourage the people who have not been vaccinated yet to do that, because they will affect their own health.
That's the picture inside Israel. What about outside? Should Israel be vaccinating the Palestinians?
We are. So we started vaccinating the Palestinian population. Part of the difficulty is with the arrangements that we have with Pfizer that states that we cannot take the vaccines out of Israel. And so what we've done so far is vaccinate Palestinians on the borders when they come into work. And we're trying to see how we can help more to our neighbors, because that's part of what we need to do here.
But Israelis in the West Bank are being vaccinated, so why not Palestinians?
I definitely support giving vaccines to our neighbors. Definitely. I think we're here together. We fight the same virus. We also fight the same problems of crowdedness and difficult places of being. And so I think we need to help each other in these times. So I definitely support that.
So why do you think the government hasn't done it till now?
One of the problems, as I said, is that you can't really take vaccines because of the arrangements that we have with Pfizer and Moderna, by the way, not just Pfizer. You can't really take the vaccines out of the country. I think the reason for that was originally for Israel not to sell to other countries. I believe that was the case to begin with. So now we're dealing with how we can move more vaccines to the Palestinians, but we're working on it.
But, people in the West Bank get vaccinated, and the West Bank is where the Palestinians live too.
So what we are saying is we're working on it. We started with the people who are working in Israel. We're trying to see how we can help with healthcare workers in Gaza and in the Palestinian Authority. We're trying to enlarge that as much as we can.
Are you worried about Israel reopening its airport and its borders?
I think one of the biggest challenges that we have right now is exactly that, is knowing that we got to a place in the pandemic that it's under control. We are opening up more and more places, and the infection rate is coming down, which is a huge achievement. And one thing that can sort of ruin things is if we get a variant that would be less or would be resilient to some extent to the vaccine. And so we need to be very aware of that, try to do what we can in order to minimize that risk. And if that comes, identify it early and take care of it. So it's definitely a challenge.
How do you see the future? Will we have a booster every year?
I assume we will. I don't know if it will be every year. I don't know if we'll need booster before that for specific variants. I don't know if it will be one booster or two. Everything is still very kind of blurry. We don't know yet. What I can say is everything that we will recommend to the Israelis will be based on science. So we're doing research on a group of vaccinated individuals to see when the titer comes down of the antibodies, to know when to suggest something. We're doing research on the South African variant to see if that variant needs either another booster or maybe we need something else, a change in the vaccine to fit it better. So every recommendation that we will give will be based on science, not just saying, okay, we think that after 6 months we need another booster. It doesn't go like this in science, and we as a physician, based on things, on evidence-based medicine. So,
thank you, Dr. Alroy-Preis.
Thank you for having me.
That's all we have time for on France 24. Please stay with us for more news.